Right, yeah, we have at least a couple more people. So. And we are live.
Okay, hello, this is Senator Mary Washington, honored to be the co-chair, the Senate chair of the Joint Committee on Ending Homelessness. We are waiting, we're here for our required meeting, interim meeting. Today is November 16th, 1 p.m. We'll be getting a virtual briefing. We'll be focusing on an update on funding, education, healthcare, and a review of the term. We're just waiting a few more minutes for us to get a quorum. So please be patient with us, but we assure you we'll have an engaged and informative session. So I'll just wait a couple of minutes, and when I see a quorum, I will gavel it. That's a long 5 minutes, isn't it? We're sitting there. We're almost there, folks. We just need one more member.
Yep, one more.
I could just, I'll just review the agenda for people. We won't formally start our meeting, but there'll be a call to order, and I'll share some opening remarks. Then we're going to hear from the Department of Housing and Community Development, Stuart Campbell and Danielle Meister. Then from the University of Maryland, Dr. Bauman, she's our Senior Vice Chancellor for Academic and Student Affairs. We're also going to hear from Healthcare from the Homeless, LaWanda Williams. She's the Chief Behavioral Officer. And then we'll have some closing remarks, and then we will adjourn.
While we can't accept the agenda, I must say it's a very fine looking agenda, Senator Washington.
Well, we will thank the staff certainly for that. You know, it's interesting to think about, you know, what we've done over the last 4 years and what we've been through. I don't think we've all fully thought about just the impacts of COVID-19, certainly, particularly on this population and all of our agencies and staff. We have representatives. I see I have representatives from two senators and 1 delegate. While we don't have a quorum, we're not anticipating doing business in this meeting, so we will wait till for any minutes to accept. We can do that maybe later in the meeting. I can fully gavel in, but I do want to get started. As I said, so this hearing is now called to order. The hearing of the Joint Committee, a meeting of the Joint Committee on Ending Homelessness. Just a reminder to all of you that this committee, and as well as the concerted efforts of the Maryland legislature to look at the issue of homelessness in our state began with a true efforts in 2014 with the formation of this committee, this joint committee, and also the Interagency Council, which combined an advisory committee that was made up of advocates and a committee that was made up of mostly agencies, and bringing them together to take a look at the issue of homelessness in our state. In particular, we had a focus on a number of populations, our unaccompanied homeless youth. We wanted to also look, certainly as always, our veterans populations, our returning citizens, families, and again, young people more broadly. And we've done a number of bills and briefings and issues looking at homelessness, not simply in the area of being a physical house, but also addressing and looking very strongly at the social determinants of health, of homelessness. And I believe we've done the bulk of our work in those areas over the last 8 years. And I want to thank members who have served this term on this committee, also members that served in the prior terms, and believe we've moved the needle in some areas, but we know we have a long way to go. The Maryland's total sheltered homeless population decreased in 2021 by about 20%. And while our estimated sheltered homeless population decreased at the start of 2021, the unaccompanied homeless youth homelessness increased. Within our population of persons experiencing homeless, we did see a decrease. We've seen a decrease over time of the chronically homeless individuals. There's been a 41% decrease of homeless families, 27.6% decrease, and on our homeless veterans. But as I said earlier, our unaccompanied homeless youth population, including individuals younger than 25 and some as young as 12, increased in 2020 and in 2021, meaning about a 35% increase. We're also very aware, our data partners tell us that while we know we're taking positive steps, we cannot overlook the impact that COVID-19 has had on the numbers. And in fact, reducing the occupancy of some of our communities that were supporting homeless services, the individuals who were concerned about their safety and staying in shelters due to COVID did not go to the shelters. And so our point in time estimates should, in their words, be viewed with caution. But again, knowing that we have our Interagency Council on Homelessness, knowing that over the last 4 years, we have sought to, in alignment with them, coordinate our state policies, our recommendations, increase working relationships among our agencies, our local nonprofits. Many of our hearings and briefings over the last 4 years have been done to achieve that, that our Department of Housing and Community Development has fully embraced that it is, while it does build homes, but also understanding and invest in properties and capital, it has fully embraced its role in disseminating information and education to the public about how to respond to homelessness. Coordinating data, we now have a better, I believe, better coordination, or at least have given a platform for our local community continuums of care. And we've requested that they not only make recommendations to the Interagency Council, but also make recommendations to the state legislature, and also bringing in our federal policy thought leaders and workers. Over and over again, I will say that what we've come up with during the first term of this work group, of this joint committee, and this term as well, is that the availability of affordable and accessible housing, resources, and housing stock continues to be a driving force in housing instability in the state of Maryland. And so we've heard that from our advocates, our business communities, faith leaders, everyone, people who advocate for our veterans, our youth, our families, and especially our individuals with behavioral health barriers to housing, that this is a major concern. We've looked at what's the pipeline to homelessness. What are the ways in which some of our state institutions, our health institutions, our correctional facilities contribute to homelessness, that intersection between health and interactions with our judicial system. So in wrapping up, I see us continuing to work tirelessly to ensure that every single Marylander has a stable home. And that means that we have to continue to do everything in our power to end homelessness. We must continue the efforts of rehousing people and making sure that we create additional dedicated housing units to house homeless people. As a legislative body, we'll continue to encourage leaders in communities across the state to partner with us and with our federal partners on the important initiative to create more housing. And again, continue to work on the social and health determinants of homelessness. And we have to ramp up our initiatives to create permanent housing to homeless people and increase the development of affordable housing. At the end or before, if any of our members want to have some words at this time, your insights and your thoughts about what we're doing, what we've done over the last 4 years, or what you see that we need to do in the coming term, I welcome that feedback. So thank you. I know Delegate Patterson has something to say.
Good afternoon, all. I'm just getting on from another Zoom meeting. But I am so delighted that we're still meeting because it is still a critical issue. Certainly, I know within Southern Maryland, we're making strides, but there are many mountains to climb, particularly as it relates to partnerships and local governments understanding how we can work together to address this homelessness issue. Not only that, but also affordable housing. We are still dealing with not in my backyard kind of folks. And so I have relied on the recommendations from our prior sessions and look forward to how we can move forward because, again, there's so many people who are counting on us to advocate for them. And thank you, Senator Washington, for your lead in this process.
Thank you. Delegates Lehman, Bartlett, one of you, both.
Well, I was waiting on Delegate Lehman. I think she mentioned she had something she wanted to say.
Go ahead.
Hi, everyone, and I'm pretty new to the Select Committee. It's such an honor to be part of this esteemed and talented group. Thank you for your opening remarks, Senator Washington. I just wanted to say I wasn't sure whether Delegate Valentino Smith was going to be on this meeting, but as I think you all are aware, she did not seek re-election. And I just wanted to take the opportunity as a fellow Prince Georgian to thank her for her service, for her dedication to housing, to affordable housing, to homelessness. Most of you know, over her 12 years in the House, was a leader on these issues and such a compassionate person. She did a lot of great legislation over the years, addressing issues around poverty and women's and children's issues, homelessness. And she actually, when she talked to me about this committee and I said, how do I get on it? She said, I'll see what I can do to help you out and recommend you to the Speaker's office. So I just wanted to thank her for her years of time on this committee and all that she did in the General Assembly. Thank you.
Thank you, Delegate. I was going to end with that, and thank you for. We should lift her up right now. I appreciate that. Very, very good. Delegate Bartlett, and then maybe Senator Sidnor, and then we'll.
Well, Senator Washington, thank you. Thank you for the opportunity to speak. I have to say that I too solicited to be on this committee because it's so important, the work that is done here. It's very, very important. And the lives that you change through the collaboration of effort is just tremendous. I'm sad to see or to hear that the number of unaccompanied minors has gone up, but I know that we have a plan and we're going to continue to work that plan and continue to make resources available and do everything we can and tweak that plan as needed. So, thanks to everyone and your work. I'm excited to hear the reports today. I read them. I have a ton of notes. A ton of notes and questions. I won't ask all of my questions here because we'd be here till probably about 7, but I will follow up with with you, Senator Washington, with those notes and see if we can formulate that into a collaborative response. So I'm excited to be here. I'm excited to get to work, and thank you everyone for all that you've done and all that you are going to do.
Absolutely. Senator Sidnor let me know that his mic is not working. Is that right? But he can hear us. And then my future colleague, but also now a colleague when we were in the House, Mike McKay. He's been there from the beginning. And Mike, Delegate McKay, we're just reflecting a little bit on the last 4 years and what we think needs to go forward as we hear this briefing and sort of close out the term of this committee. So I'm inviting you to say a couple words if you don't mind.
Thank you, Senator. Number one, the work we do on this committee is a statewide problem. It is unfortunate we have to have this committee. And so whether it be during the 95 corridor or even up here in Western Maryland, this problem needs to be addressed. And the biggest thing that I see here in Western Maryland is the NIMBYs, not in my backyard. We announced that we have a homeless shelter that's going to be has been given some grant funding from the city of Cumberland. We're going to be moving into a new place. It's about $3.8 million project, and we look forward that's going to help eliminate our mission. But thank you for your leadership. Thank you for all that have been on the committee with me. And if I can be of assistance, I'll be over at the red carpet side of the General Assembly. But thank you, Senator.
All right, thank you. And now we will begin our briefing. As I said, we're going to start with the Department of Housing and Community Development. Mr. Campbell and Ms. Meister, please begin.
Great, thank you, Senator Washington and members of the committee. It's good to see everyone. I also want to thank Delegate Valentino Smith for all of her great work over the past several years. It's been terrific working with her, and I'm looking forward to seeing what she does next. So good afternoon, everyone. I'm Stuart Campbell. I'm with Maryland Department of Housing and Community Development. We don't have a lot of time, so I'm not going to be able to cover everything we've been doing in the last few years, but I do want to bring some highlights to you all. So we can go to the next slide, just some brief introductions. We do have some changes at the department. I'm now the Deputy Director of the Division of Neighborhood Revitalization, which I've always been a part of, but now Danielle Meister is my successor as the Director of the Office of Community Services Program. So I'm going to provide some highlights and then turn the bulk of the presentation over to her. If we go to the next slide, I can start with the agenda. Again, I'm just going to provide some highlights from the past year or so. We're going to go into COVID-19 funding that we received to address homelessness and what we utilize those funds for, give you all an update on our homelessness solutions program, which, if you recall, is a combination of a number of state and federal programs to address homelessness that we combined about 4 or 5 years ago. And then finally end with youth homelessness funding update. So on the next slide, just as Senator Washington mentioned, the point in time count has some caveats to it for sure, but it is also one of the only consistent tools that we have to measure homelessness. And I'm delighted to say that since 2015, homelessness in Maryland overall has dropped 36%. And I know that is due to a large part of the terrific support that this committee has demonstrated in the General Assembly and the governor towards the programs that we administer here at DHCD to address homelessness. Certainly, it was not all our doing, but we have really worked hard to connect and coordinate with the continuums of care across the state and help them with the resources and training that they need. I can talk a little bit about what we've been doing with all of the COC. Oh, no, back, still one more. There we go. With all of the COCs and the community action agencies, which are part of the anti-poverty network across the state. We continue to have monthly peer sharing and technical assistance calls with all of the COCs. We provide an opportunity for them to share with their peers, find out what's going on, troubleshoot, and try and find solutions to some of the challenges that they may be finding. And we started that at the beginning of the COVID pandemic and have continued on through the last several years because it's proved so helpful. We have really focused on enhancing our training and professional development. Using some of our COVID funds, we actually brought on a dedicated trainer to help with that. We've sponsored 40 service providers to participate in the Maryland Equity and Inclusion Leadership Program, which because we recognize that disenfranchised populations and communities are particularly vulnerable to homelessness, and we wanted to focus on the service providers understanding the need for equity and inclusion in the programs and services that they provide. We also have been funding stipends and compensation for people with lived experience. We allowed, for the first time, that to be an eligible expense through our programs because we recognize, again, that individuals with lived experience really are the ones who are the experts, and we want to provide an opportunity for them and an incentive for them to participate in the leadership of the continuum of cares across the state. Going into the next slide, I can give you an update on the Maryland Balance of State Continuum of Care. If you recall, in 2020, we merged 5 COCs, and then in 2021, Hartford COC joined us. So 3 of the Western Maryland counties, Garrett, Washington, and Allegheny, Cecil County, and the 3 counties in Southern Maryland were the initial COCs that merged into the Balance of State, and then Hartford COC joined us a year later. We serve as the lead agency. We operate the Homeless Management Information System, which is the federally mandated data collection system. We prepare the annual HUD funding application. We are responsible for training and performance improvements assistance and provide just general support to staff, the governance structure. The former COCs are still regional local planning groups, but they're now called local homeless coalitions, and they play an active role in the governance of the COC. One of the immediate benefits that we were able to see is that when we submitted our application in 2021, our score went up 20% from pre-merger all the individual COCs applying separately, we were able to see an increase in the score of 20%. Unfortunately, the way HUD scores things, it doesn't necessarily translate to an increase in dollars by 20%, but we did see an increase in funding, and it makes us more competitive, which in the long term is really what is going to pay dividends. The next slide is just a map that shows you the continuum of cares in Maryland. The dark blue ones are the balance of state, and then the other colors represent the remaining 11 or 12 COCs that are in Maryland. So I am now going to turn it over to Danielle, who will give you an update on what else we've been up to.
But just before you go, I just would like to see if any members have any questions for the Deputy Director. No? Okay. All righty, Danielle.
Great. So it's, as you can imagine, been a really busy couple of years. And you'll see that starting on this next slide, if you don't mind forwarding it. So in addition to just the normal work that we do around homelessness, we have been deploying a variety of COVID relief funds over the last couple of years, mostly through the CARES Act, as well as the American Rescue Plan Act. And the federal government awarded a little over $1 billion specifically towards homelessness, both to local counties directly, as well as to the state. And largely we pass through our funds to local communities. But it is a mix of federal allocations. Some go directly to counties and some come through the state. So we wanted to just cover what some of these funds have been doing and where we are with the status update. A lot of funds are sunsetting now that we're getting towards the end of the CARES Act expenditure period. And so we are already starting to plan for, how do we continue the programs that were either launched or expanded with these dollars. So the first resource that we had come online was an expansion of the Emergency Solutions Grant through HUD from the CARES Act. And that allows us to do street outreach, emergency shelter, homeless prevention, as well as rapid rehousing. And we can do a number of services: rental assistance, supportive services, shelter operations, capital dollars even, to support the construction of new facilities. So total across the state, the allocation from the federal government was about $50 million. That has since actually risen. The state of Maryland did so well at spending down our ESGCB funds. We were reallocated an additional $775,000 recently. So our total is now up to $51 million in funding. We're about 70% through that allocation now, and the funds will largely expire by September of next year. And that special pot of reallocated funds we have can last us through June 2024. So we're in the process now of figuring out where the greatest needs are for that additional allocation. But we're about 70% of the way through those. We also utilized a portion of American Rescue Plan Act funds, specifically state recovery funds, for additional support to continuums of care. It supported both shelter operations as well as short-term rental assistance for households who are either gaining or need to retain their housing. And that was about $15 million and will expire most likely in June of next year. The largest source of funding that we saw come online was the Emergency Rental Assistance Program. So statewide, the initial allocations were about $752 million, and they've since grown to about $755 million through the federal reallocation process. Again, we've done a pretty good job statewide of spending those funds down. So part of that process is being eligible for more funding. So far, we are about 75% expended from those funds statewide. So that's a combination of both the funds that pass through the state to local jurisdictions, as well as direct grants to the largest 8 counties in Maryland. And technically, the funds can be used through September 2025 with some caveats around progressive spending deadlines that have been set by Treasury. But we are anticipating that most of these funds will be fully utilized and spent down by this spring. So February, March is kind of the timeline we're looking at for most jurisdictions across the state to spend those funds. Next slide. The next resource we had available was the Community Services Block Grant expansion through the CARES Act, and this was about $13 million statewide. It comes through DHCD into our community action agencies across the state, and that just ended. So we are in the process of doing closeout reporting for that. We also had access to the Community Development Block Grant, which does a lot of construction projects, but also can support programs that provide rental assistance, social services programs locally. And that was about $100 million across the state, a combination of, again, some direct funds awarded to counties by the federal government, as well as state pass-through dollars. And there are spending restrictions for that. 80% of CDBG funds have to be spent by next year, and the balance can be spent down until 2026. Another great resource that we had available that did end recently is access to non-congregate shelter that was funded by FEMA dollars. So FEMA, for a long time, about a year and a half, reimbursed non-congregate shelter projects. So typically that's going to be a hotel or a motel. It may be a facility that has individual rooms, if that was available. So local projects launched some non-congregate shelters, particularly when decompressing shelters was a massive priority to protect the safety and the health of folks who are living in those spaces, in an effort to create proper social distancing and protection from each other. And so that ended in June 2022. And we've not seen an impact from that resource going offline. I think we've been able to cover the needs for sheltering and non-congregate shelter through other resources at both the local and the state level. Next slide, please. Another resource that has been incredibly helpful are emergency housing vouchers. So these were a special bucket of housing choice vouchers allocated by HUD specifically to households that were experiencing or at risk of homelessness. And I think most jurisdictions across the state that received these targeted them towards people who were currently homeless. It did come with some limited services funding, which is unusual. Usually housing choice vouchers do not come with supportive services funding. It's solely rental assistance. So this is kind of a unique program that offers a little bit more support to folks who are entering into housing. And DHCD received about 196 vouchers, and 612 went to various other public housing authorities across the state, mostly urban jurisdictions in entitlement areas. And those vouchers are permanent, but they have some turnover clauses. So after this year, when a voucher is terminated, maybe someone moves on or they become ineligible for the program, that voucher does not renew. So that is a resource that over time will start to go away. But as long as someone is connected to that voucher and they don't turn over, they have that permanently as a resource for rental assistance. Another project that is just getting started for a lot of jurisdictions, but was allocated through the American Rescue Plan Act is Home Dollars. So Home is a program that's a HUD formula program. We receive home funds throughout or each year, both local entitlement jurisdictions as well as DHCD. Generally funds a lot of development of rental housing projects, affordable housing across the state. And so under the American Rescue Plan Act, there was a specific allocation to target some home funds towards households who were currently homeless or at risk of homeless households. And we can use those funds for a variety of purposes. One is either, production or preservation of affordable housing units. We can also use it for tenant-based rental assistance, supportive services, a wide variety of supportive services, I should add, as well as potentially purchase and development of non-congregate shelter. So this resource is a little bit longer term. It expires in September 2030. And right now, jurisdictions across the state are preparing allocation plans for how they want to spend those funds and submitting them to HUD. So a lot of local jurisdictions are going through public comment, hearings to hear what the needs of their constituents are and what those funds can best be used for. So we'll have a better picture in the next few months about how local jurisdictions plan to utilize that. But we have until September 2030 to spend those dollars. Next slide. There were also a couple other resources that, while they aren't specifically targeted towards homelessness, ultimately, will benefit low-income households as well as households that are homeless. So there is an emergency broadband benefit program that was established that complements the federal emergency broadband program. We also are administering the Homeowners Assistance Fund, which was funded through the American Rescue Plan Act. That provides mortgage relief as well as some grant programs for homeowners. And there are other state and local recovery funds that are supporting low-income households and households who are at risk of losing their housing. Next slide. So the Homeless Solutions Program is our normal program that we operate year-round and on an annual basis, and is separate from these COVID relief programs that have been coming through. We are really excited this year. There was a $5 million increase in the budget for the Homeless Solutions Program for the fiscal year that started July 1st, which brings our total annual allocation to $15 million. And so we're particularly excited for this for a few reasons, as you can imagine. One is that through these COVID programs, we have set up a lot of new programming. We've expanded the number of households that we can serve with our rental dollars, with rapid rehousing. So this increase in HSP funding will really help us continue some of that level of service, even once these COVID-19 funds are no longer available to us. So we're very excited about this new resource, and it will be essential to making sure we can keep people safely housed. We also are using these funds to address some cost issues. So I'm sure folks have seen news articles about this and have heard about this from constituents, but rental costs are dramatically increasing across the state. Estimates are showing that rental units have gone up in price by about 18% over the last 2 years during COVID. And so one of the challenges we're facing is that our programs that use rental assistance, like homeless prevention dollars or rapid rehousing, it's more expensive to get people into housing and to sustain them there for the same number of households, right? So this increase in funding will really help us address some of those really rapidly increasing costs. While HUD has been trying to assist with this by increasing fair market rents, it's still not enough. It was only a 10% increase. So we are partly helping make up the gap through these state allocations in solving this issue. The other challenge we're facing is just inflation in general. It takes more money to operate our existing shelter programs, to purchase the supplies that the programs need, purchase meals, purchase client assistance items. So these increased funds will help us address those issues. And then last but definitely not least is really using this as an opportunity to bring compensation for our homeless services workforce to a place that is a livable housing wage and ensures that we can really attract and retain qualified people in our programs. It's really important that frontline service providers are able to get folks that are skilled, that have been trained properly, and are able to deliver services in a competent way. And so ensuring that the compensation matches that has been really important. So we've used this as an opportunity to meet a variety of needs, and we're really excited to see how this rolls out over this next year. We awarded these funds through our normal HSP process, which is competitive. So continuums of care submit an application each year detailing how they would use the funding. They also report out on their system performance. So how are they doing at ending homelessness? Are things getting better? What are the biggest challenges? And so we are awarding these funds through that process. And that's in addition to the youth funding that I'll talk about here in just a second. Next slide. So the last part that we wanted to talk about, because we know this committee is very interested in it, is how are we addressing youth homelessness? A few years ago, the governor did allocate an additional $1 million of state funds annually for support of the Ending Youth Homelessness Act. And these funds can be used to provide youth with a variety of services. We can do both the traditional services of street outreach, rapid rehousing, and homeless prevention, but we also can be a little bit more flexible and pilot some new ways of serving youth. Maybe it's family strengthening. Maybe it is, getting folks connected to benefits. Maybe it's employing youth. So we have a little more flexibility with these state dollars to meet the needs of unaccompanied youth. Again, we select these projects through our annual RFP process with COCs. For this most recent fiscal year, we had applications from 12 COCs and balance of state local homeless coalitions. And together they submitted 14 applications that totaled over $2 million. So there is a tremendous amount of interest from our local providers. There's a lot of service providers who are ready and willing to step up and provide these services. And we're really pleased that we were able to fund all 14 projects at about $1.4 million. So we use some of the regular HSP funding to supplement the special dedicated youth funding and go above that $1 million that's been allocated. Next slide. These next two slides are just a list of the youth projects specifically that were awarded. So you'll see we have the COC or balance of state LHC listed on the left side, the region they're part of, the provider, as well as a description of the project and how much they were awarded. As I mentioned, there were 14 projects in total, $1.4 million allocation. But you'll see there's a variety of projects in here. There's some youth dedicated shelter, which is a best practice. Young people particularly find the shelter system hard to engage with and often don't feel safe accessing those services. So having youth dedicated shelter is a really critical resource to develop. And there's also, particularly this year, a lot of investment in rapid rehousing specifically for youth, as that includes both single and parenting youth. So we were very excited to see that. And there's some really great organizations who are providing or launching drop-in services for youth, which have also been named a best practice for serving unaccompanied youth. Having those housing navigation services, navigating youth to benefits they might be eligible for, workforce programs, getting those folks connected to other community resources is really critical. Okay, and there's one more slide, but I won't run through all of these, so happy to take questions about any of this.
Great, thank you. Delia Bartlett, is there any questions for you?
Yes, I do. So my first question, well, like I said, I'll try to narrow it down. How often are participants who were once homeless hired through the Department of Housing and Community Development? So, I mean, our goal is to end homelessness. And one thing that does it is, having a job. So I was just wondering if we know that number or if we can get that number.
Delegate, you're referring to the programs that we fund, that how many formerly homeless individuals were hired. Is that right?
Yes.
All of them, yeah. I think
Yes.
that's a number we'll have to get. It isn't something that we track, although it's not a bad thing to track at all for the reasons that you stated, but we haven't tracked that, but we can certainly look into seeing how feasible that would be.
Okay, great. Thank you. One other quick question is, if I may, Senator Washington. One other
Yes,
quick
of
question.
course.
Okay, thank you. I'll make this one fast. Are there what I called accountability visits to any of the COCs or any of the shelters or anything of that sort? Because while I understand that homelessness has gone down, the number has gone down, for lack of a better way of putting this, without any disrespect to our COCs, but if you're in the business of taking care of folks who are homeless, if you work yourself out of a job, out of a need, then, you're no longer relevant. So what is the accountability? And I know there's an extensive, because I remember in one of our hearings or our briefings, there's this extensive requirements that are in place. But I really want to know about, are there accountability visits? Are there some way of knowing clearly that we're not merely rehousing folks who have been, homeless for some period of time and then they're out, or that we're housing new individuals, that these numbers all consist of new individuals or primarily of new individuals. That's a two-part question, but
Sure.
If you could help me with that.
Yeah, and I could start and then Danielle can fill in, I'm sure, the blanks that I'll be leaving, but of course, we do monitoring visits for all of our grantees, and we focus on a number of things when we go out. One is, of course, we look at their finances. We want to make sure they're spending the money appropriately and they're not, there's no fraud or other types of abuse like that. We also look at client files to make sure that everyone's eligible, that there's nothing unusual with the client files, that there aren't any red flags that we would notice. The other thing, though, it's kind of interesting, and HUD was really smart doing this. They actually reward COCs that are more successful at rehousing people and getting people off the street. So they want to look at people that are in a shelter for as short a possible time. They want first to help folks that have been homeless the longest, which is actually so chronic homeless, which is I think the image that most people have. That population makes up only about 20% of the overall population. So a lot of people who experience homelessness are actually new to homelessness because of a life event that's caused them to lose their housing. It could have been a health issue, loss of job, death, divorce, mental health issues, whatever. And so HUD looks very carefully at that. So when applicants apply for funding each year, the more successful ones are the ones that they want to fund. They want to give them more money. So there's an incentive to be successful in actually helping the hardest to serve and the folks that really need the most help and getting them out of homelessness as quickly as possible.
Thank you so much. That's exactly what I wanted to hear. Thank you.
Oh, great. Okay, well, then happy to say it.
Well, great. Delegate Lehman.
Thank you. So I was interested in the table that showed that ERAP 2 funds can now be used, up to 25% of them can now be used for development of affordable housing. So one question and one comment, which is first the question: how is DHCD getting the word out about what I assume is a change of the ability to use funding toward development of affordable housing? How are you making local governments and nonprofits aware of that? And then the second part of that is my comment. I'm glad to see this because I'm really concerned that there is not nearly enough emphasis on development of affordable housing. That's the long-term solution to homelessness. I mean, it is just flat out. And you can talk about how whatever percentage of folks who are homeless for the first time because of some setback or some change in their life. But the fact is, with the rising cost of rent and the really stiff resistance by landlords to any attempts at rent stabilization laws, we're seeing this playing out here right now in Laurel. Kudos to some new city council members who have made this their top priority, is getting rent stabilization passed. And these big landlords are coming out of the woodwork, and these interest groups to just attempt to squash any effort at that. But if somebody is experiencing, some situation in their life that, and they're living paycheck to paycheck and end up homeless, the reason why they can't quickly get rehoused is the cost of housing. And it's even, it's a challenge while they're in that housing, but then once they're homeless, the cost of getting back in, when you look at, first and last month's rent and security deposits and all of that, we have a real crisis situation. And I just think a lot more of these programs need to be not short-term and emergency situations, but long-term development of affordable housing.
I agree.
Well, Danielle is our ERAP expert, so I'm going to turn it over.
I can definitely tackle that first question about affordable housing development. So, the way that ERAP worked is there were 8 counties in Maryland. The largest 8 received their own allocations from Treasury under ERAP, and then there's also the state allocation. And so technically, each of us can spend up to 25% of those allocations on developing affordable housing. So I do know there's some local counties who are thinking about using some of their ERAP to develop that housing. I don't think anyone at this point has put forward a specific plan or an amount that they're intending to use. We're just now getting to the threshold where we're allowed to do this work. We have to spend 75% of ERAP2 before we can use the 25% for affordable housing. So a lot of folks are just now starting to get close to that threshold where they can actually do affordable housing. For the state, we have allocated, I think it's 21 million or 25 million at this point. So it's not the full 25% we could because we needed it for rental support we just are still continuing to see an ongoing demand for rental assistance. But we've reserved about 25 million to develop affordable housing. So we haven't started that work yet. We're still working on meeting our threshold for the 75% expenditure rate.
If I could ask a very quick follow-up, Senator Washington. So where was that formula set, that 75-25? Does that come down from the feds? Is that a state decision?
Right, it was congressional. Yeah, they wrote that into the statute for ERAP2. So there's, you have to use 75% of your allocation first on financial assistance or housing stability services before you can begin to do that affordable housing work. The other requirement is that you couldn't start until October 1st of 2022. So that's why a lot of jurisdictions haven't yet, made a decision because they were waiting to see how much of an ongoing need there would be for rental assistance. We still, estimates are showing there's still about $300 million of rent debt in Maryland that's owed to landlords. So a lot of jurisdictions have been trying to meet the needs of the applicants they already have before they make that call. But the 75-25 threshold was set by both the statute and Treasury.
Thank you so much. And I'd love to talk to you a little more offline about, possible regional collaboration to use that funding. I think of the Laurel area as, it's a multi-county area where homelessness is equally challenging in the 4-county area that makes up Laurel. So I'd love to talk to you further. Thank you so much.
And Delegate,
challenge.
Delegate, I think there's so many of our challenges that should be addressed regionally, and you represent an area that's absolutely an example, of that. And having a regional approach can leverage resources. So I think that's something we could look at our recommendations for the upcoming term as to how do we get, sort of multiple counties working together on applications to address it. So thank you. Others? Okay. Well, thank you both. And again, thank you so much for your work over the years and your partnership. Now we are heading to our next folks. So make sure I have my thing. So yes, let's hear about our schools.
Thank you very much, Senator, and members of this committee. My name is Dr. Joanne Boffman. I'm the Senior Vice Chancellor for Academic and Student Affairs for the 12 universities, the University System of Maryland. All of our campuses are focused on student support in general, but today I'm going to be focusing on those that meet the criteria from the legislation that you all have passed and opened up some opportunities for students who are either coming out of the foster care system or are unaccompanied homeless youth. Our current count across our campuses is 187 students who have been brought in and are being given full wraparound services and housing under these benefits. All of our campuses have food pantries that, of course, go well beyond this population, but this population also has the opportunity to use our food pantries that also have personal hygiene products, and some even have clothing and other items. What we did in preparation for this meeting today was I asked our campuses to tell me something about what they are doing that I could bring alive for you some of the things that are happening on our campuses. Bowie State has individual and group counseling available for all of these students, but they use a case manager model at Bowie State. So there is a person who is focused on helping these students with all of the kinds of challenges that they have. At Frostburg State, we have 13 students, and 12 of those are supported with full cost of attendance covered for them. One student, unfortunately, did not fill out the FAFSA in time to get some of the benefits. So you can see that there are still small hurdles that we have to deal with on a case-by-case basis. But I can assure you we are watching each one of these students. Salisbury University has taken a different approach. They have a single person who is in fact responsible for this group of individuals on their campuses, making sure that all of the wraparound services are available to these students. Towson and UMBC guarantee housing for those students, and they have student affairs, residential life, and other groups that are working together to make sure that these students are supported. College Park has a special program called Fostering Terps. Since 2019, more than 100 students at College Park have received all of these benefits being served. Currently, there are 30 students working with their case managers, making sure that students are getting all of these benefits. As has been mentioned, the pandemic was disruptive for everyone. It was disruptive for our campuses, certainly. And you may have heard that we sent everybody home. Well, we did not send everybody home. If you did not have a home to go to, you stayed on campus, in campus housing to keep campus support. So in fact, throughout the pandemic, we had any homeless individuals and some international students that were housed on campus. It was lonely, I will grant you that, but they did have housing, food, and support services. One of the things we learned during the pandemic was our campuses worked very closely with the local health departments in providing services in everything from testing and vaccination sites and so on. And that model, I think, is going to support even better collaboration between our student services and the local social services groups, we learned that working together, we can cover more ground. And we know that some of these individuals have family members that are in need of services as well. So we think that these connections may be really important. Our campuses, I can tell you, are challenged to be everything to everybody, providing social services for all of these students in need, when in fact, mental health services are a real challenge for many of our students on campus. So we are stretched thin, but nonetheless paying attention. And I want to reiterate that the legislation that you all have passed over the last 4 years have provided very important access for these students to higher education at our institution. One of our challenges that was pointed out, though, that I think we need to work on a little bit more is that some high school counselors are not fully informed about the importance of certain designations. We need to know which students meet these guidelines, meet these definitions, because from our perspective, providing these services is really an unfunded mandate to us, but we are set on providing these services to students, but we need to know who they are. So we know we have more work to do with our high school counselors and recognizing all of these students who meet all of these criteria. I know you received the report from MHEC that in fact gives you more numbers, but I would also say that Maryland State Department of Education and MHEC could be more helpful, if you will, in helping us identify some of these students. Individual counselors are important, but we need to make sure we know who all meet the definitions for these exemptions under the law. We know that there are cases that we've been missing. We find this out anecdotally, and then we can move in to help support those students. We know, however, that even those students that meet the exemption, these nearly 200 that we have now, does not begin to meet the need of many of students who fall just above. They may not have been homeless at that point in time, but still have many challenges. Our student services are constantly trying to figure out who else may need help. This is one of the reasons that our food pantries end up being a really important touch point for our student services, because students who are using those food pantries regularly may be in need of additional services and support, and we pursue those. I would remind you, though, that since this legislation was passed and over the last few years, we've had a tenfold increase in the number of students being served by our campuses under these guidelines. We sincerely appreciate the help that you've given us in recognizing this essentially invisible population to us on a college campus. We need to know who these students are so we can reach out to them. We will continue to provide all the support we possibly can on our campuses. And our bottom line hope is that these nearly 200 students that we currently are serving now under these guidelines, we are putting them on a trajectory out of homelessness for the rest of their lives. We want to put them on a path to success. And my own personal hope is that, in fact, some of these students will, in fact, go into the social services area. Comment was made earlier that lived experience is so important. So in fact, these students trained and educated appropriately could come back and be a support to the next generation. So I want to thank you all again for helping us recognize these people and providing the support when and where needed. So thank you again.
Thank you. Senator Sidnor.
Thank you very much, and good afternoon, and thanks for the presentation. Two questions. One, the student that missed the FAFSA deadline, that's number one. And number two, I know when educators talk about students, there's always this mystery of trying to get information, because they say that I guess because of federal law, there's certain things that they can and can't share. But I'm wondering, when you apply for financial aid, I mean, it would seem your university's financial aid office has all the financial information that you need. So where's the disconnect that you can't identify the students prior to them even coming to campus?
Well, I appreciate your comments, and the one student was recognized early enough so that even though they couldn't tap into certain financial aid, there are other flexible financial aid points that they can get to. So in fact, we were able to stopgap
Great.
that. But in fact, if a student is Pell eligible, of course, we want them to use their Pell grant first so that our campus-based dollars can go further. So we do have stopgap measures. The point you make about financial aid is extremely important. A student can tell you about financial aid and the need for financial aid, but if in fact they are truly unaccompanied homeless youth, or if they are coming out of the foster care system, we are obligated and happy to provide broader services to them so that in fact it's full cost of attendance that in fact they qualify for. And we want to make sure that we are giving them all of the benefits that they need. And the financial aid process may not expose, for example, a student who has been homeless. One of our challenges is what we call couch surfers. There are students out there that move from house to house, and unless they tell us that story that they are truly homeless rather than just couch surfing, we can't put them into this other category because there are certain criteria that they have to meet. So I will tell you that one of the things that we are finding in general, and I think the pandemic has exacerbated this, our faculty are becoming much more aware of students in mental health stress. And in fact, these students would fall into that category more quickly than some other students. And our faculty are being trained better, not to delve into or fix the problem, but to know who to send these students to. That's why the new case manager model on some of our campuses is working very well. Student may be referred to student services, but if we can get them to the case manager responsible for this population, we can provide them the full package that they deserve.
Thank you.
Thank you. And if I could follow up, Doctor. So I hear a few things. One, but I too am interested in the disconnect. You mentioned MHEC. And so perhaps as we're, again, thinking, if we're looking at the legislation or regulation, if you could specifically tell us what things would sort of close that gap so that, we can, regulate it or provide the support. The other thing, I heard you say the words unfunded mandate, and I understand. And so I think we'd also like to understand what you're spending or what you need to fully support these young people. So please get back to us, tell us what that is, what that number is. And then finally, it's that last bit, that was raised earlier about the career ladder model. Mm-hmm. So once these young people, young adults come in, how are we tracking them and supporting kind of a peer support on the campuses, and then you also mutual aid societies, both in Delegate Lehman's as well as in Baltimore City. There are mutual aid societies that are run and supported by adults who were either formerly homeless or who are currently providing peer support. We'd love to see more of that throughout the state, but there's probably a real opportunity on college campuses as well. And actually my real final is, I know we started the first funding of the Ending Hunger on college campuses. Yes. Very modest grant program. We hope to, I hope that we will grow that in the years to come, but that connection between homelessness and hunger on our colleges campuses, yes. And not just our young people, but our returning adults and et cetera. I think we really need to look at that. And Delegate Patterson wanted me to mention that she's also very concerned about our community college students.
Yes.
Some have pantries, but there's nothing coordinated as noted at the 4-year level. So I do think that might also be something that you could talk with your colleagues about, and what would a full program look like that at ending homelessness and hunger in our colleges and universities?
Well, I appreciate all of those questions, and we will get back with MHAC and make comment to MSDE. We do work with MSDE as well, hoping that they can provide better information to all of their counselors so that they understand that this is a small gap, but an essential gap to be filled. I will tell you that when the USM comes forward, each of the last few years, when we have asked for additional funding, the primary target has been financial aid for students in need. So in fact, that would help. It would raise the water for all boats, including these students, and help other students in need. And you're absolutely right. This connection with the food pantries and so on, it turns out to be a really critical connection. And one of the things you mentioned was peers. And in fact, many of the food pantries are in fact staffed by students who have been appropriately trained. So in fact, the people coming in and asking for help there can get some contact and then be appropriately referred. And we're very appreciative of our campuses that did get funding this year from that small amount. You're right, we need a lot more, but it was a great start.
Okay, great, thank you. Delegate Lehman, I just see you doing, okay, no, just thoughts. Okay, well, thank you. We will continue to look. And again, please feel free, we're writing recommendations, and please let us know what you think we should be doing. And finally, Lawanda Williams, it's good to see you with Healthcare for the Homeless. Again, a partner, an example of one of the many, many, many partners that we have, and certainly looking at that intersection between health and housing has been what you've been doing for a long time. So please share with us what you think we should know.
Yeah, thank you so much, Senator Washington and fellow committee members. Really happy to be with you all this afternoon and talk a little bit about who Healthcare for the Homeless is for folks who may not know, and to talk a little bit about what we've been up to since COVID-19, although it feels like, COVID-19 has it's hard to remember a time without it at this juncture, but I'll talk a little bit about what we've been up to during this time and some of the things that we've been concerned about and just focusing on from an advocacy standpoint. So for people who don't know, we are a federally qualified health center, and we've actually been around since 1985. So an organization that is 37 years strong. We have about 240 employees when fully staffed, and we have a number of different sites throughout the Baltimore area and surrounding county. Our largest clinic is here in downtown Baltimore at 421 Falls Way. We have a location in Grace Memorial Hospital, which was the prior Bon Secure. We have a location in the Eastern Family Resource Center out in Baltimore County, East Baltimore County, a convalescent care program. Right down the street from our clinic at 620, which is inside of the city's largest overnight shelter. We also have a mobile clinic that goes all throughout the community and locations serving individuals on the street and in shelters and transitional housing programs as well. And so we have a cadre of numerous services that we provide here, including medical services, behavioral health services, substance abuse, dental and case management, benefits and enrollment assistance. We have a small but mighty outreach team, a team that focuses on population health work, which was critically important during the pandemic, especially, and also a full functioning and very vibrant psychiatry team. So lots of services and really centered on client-centered and whole person care. Sustaining during the pandemic has been a real exercise. It's one that we have been able to do, and storms we've been able to weather with our staff and with clients. But there were a number of things that I think sort of characterized our work during the last couple of years. One, we really made a very strong and concerted effort to stay connected with our clients. Just a commitment to keeping our doors open became first and foremost for us. And literally what that meant was having a process where we were all hands on deck. We were very steadfast in our desire to be open. We know that we are a place where people come and often don't have other alternatives. And so if we close, we are often it for many folks that we are serving. And so what that meant was that we had front desk staff, we had administrators, our CEO, myself, medical providers, peer staff workers, therapists, doctors, psychiatrists, policy folks, all manning our front door during temperature checks with clients coming in, asking screening questions to make sure that people were able to come in and be safe, and that we could connect them with screening and testing. And eventually when vaccines became available, helping people to get back access to vaccines. And that really was a very central part of our work that has continued to this day. We still have individuals who are helping out at the front door and screening individuals when they come into the building. And so, you know, we aren't doing temperature checks now, but we are still doing the screening questions upon entry. You know, during the pandemic, it really caused us to have to think really creatively about how to continue to serve people. And I think it really tested the things that we thought we knew. And I think now we know better. One of the things that we thought we knew is that we'd never be able to connect with clients over the phone because our clients don't have phones. You know, our clients are living transient lives in many times. They're living their lives in public spaces. It's very hard for people in general to keep up with phones, let alone, you know, having the added barrier of not having a stable place to put your things. And so we thought this is going to be disastrous. We're never going to be able to keep up with people and connect with people and get them in care and keep them in care, because now we have to limit how many people can be in our building. When the state of emergency happened, we were encouraging people to not be out, and people should not have been out in droves. How are we going to get people and stay connected? Well, our clients had phones and they held on to their phones, and we were able to connect with people over the phone, which was really interesting. And that had, to be quite honest, in the first months of the pandemic really was the saving grace, I think, for our clients. We were able to keep people in care. We were able to very quickly, once we sort of recognized that and that people were interested in staying connected with us over the phone, we very quickly shifted a lot of the ways that we were providing services, therapy visits and medical visits, our groups, our subgroups, you know, and wanting to make sure that people still had access to substance use services, and developing those and protocols to be able to deliver group settings over the phone. It was critically important. One of the things that we know about substance use disorder is that it's, you know, the antidote to use is actually not sobriety. Oftentimes, you know, it's connection. And so having ways that people could stay connected during the pandemic was critically important. During this time, and I think even now, we talk about people needing to be socially distant, right? And so we need to be away from each other. We need to give each other our space and be socially, social distancing. And what I actually think is that we need to be physically distant, but we need to remain socially connected. And so it might feel like semantics in one aspect, but it really is much more than that. People die from loneliness and disconnection, and we found that it was critically important to make sure that we were giving people outlets to stay connected to us and connected to each other. And really it became a matter of thinking about what are the most important things that we needed to do to make sure that we sustained safety in life for the people that we're serving. One of the things that we did was making sure that we were still able to do a lot of the home visits that we were doing. And a big part of our work here at HCH we are serving individuals who are currently experiencing homelessness, but we also have a very big part of our work that I actually am very much involved with and provide leadership to in our housing services team, where there are clients who have exited homelessness. We've helped sustain them and help them connect to long-term housing placements. And we're going out into the community and doing home visits and all of those things. Well, during the height of a pandemic where no one really knows what's happening and what's going on, we had to really shift very quickly to be able to make sure we had proper PPE, training staff to be safe in the community, developing written guidance for people. We actually hand-packed ourselves individual PPE kits for staff to be able to grab and go when they needed to go out and do safety checks and wellness checks with clients who we were not able to get in contact with. We developed a lot of protocols around what we like to call life-sustaining services. So those two things are food and medicine. People need their medicine and people need food to live. And so a lot of our work shift and focused on being able to get food to people. Very early on, the bus routes closed down for a very good period of time. A lot of the community food shelters were shifting the way that they were doing things such that people could come and get food through drive-ins. Now, one of the things that made it really complicated for the individuals that we serve is that they don't have cars oftentimes. So being able to drive through and pick up food was very difficult. So we did the driving through, and we did that for a good bit until we determined that we could actually develop a food pantry program and do food deliveries by partnering with the food bank. And so from pretty early months in the pandemic up until this very day, in fact, just yesterday we did a delivery, but we go to the food bank every 2 weeks, pick up fresh produce for clients, bring it back here to our office, sort it, bag it up, and hand deliver it to our clients. And we've been doing that since the early days of the pandemic. And the same thing goes with getting people their medications when they need them. So those were things that we were not doing prior to the pandemic, and really saw that these are life-sustaining services that we need to be providing to individuals that we're working with. I think one of the other things with respect to service shifting was really in our MAT program, our medication assisted treatment program, where we created a lot of low barriers. We thought we were a low barrier before. When individuals were not able to come on a regular basis to actually pick up their Suboxone, we needed to make sure that we were able to do telephone check-ins and to provide prescriptions for individuals for an elongated period of time. And typically what people think is that, when you're delivering MAT services, you need to see people pretty regularly, you need to be getting urines all the time and all of these things. And we actually saw that even with relaxing some of those regulations, people actually still stayed engaged. People actually took their Suboxone. People did what they needed to do to maintain their sobriety and staying connected with us. And so it helped us to sort of recognize that we need to be as client-centered as possible to make sure that we keep people engaged in care, because no matter what service you have, when you're trying to deliver it, if people can't recover if they're dead, they don't have a chance to do that. And so our goal was to keep people alive and keep people with access to the medications that they need to do that. We started doing things during the pandemic, the early days, and still continues now, with making Suboxone available for clients who are coming in to get representative pay services. One of the things that we do here as an agency is that if someone, if you're unfamiliar with rep pay services, we actually will become someone's representative pay through the Social Security Administration if they've determined that the person needs more support with managing their funds. And typically this is for individuals who have goals towards housing and we're working with. And we have a whole team that manages that process. But suffice it to say, when people are coming in to get checks, we provide them with naloxone as well. So we make it available at every stop that we can to make sure that people have access to the things that they need to help themselves and to help others. So those are things that we saw that were really critical during the pandemic and up until now. I think one of the other things, you know, and myself as a clinician, I'm a licensed clinical social worker here, and one of the things that we always think about is wellness and well-being. And this is one of the things that was a real struggle during the pandemic for our staff. It was a very difficult time. I think we experienced turnover, you know, just as I think most people throughout the continuum and probably throughout the nation experienced. We had staff who themselves had loved ones that did not fare well during the pandemic. People lost loved ones. We had a lot of staff who were dealing with grief and loss. Grief and loss related to clients, grief and loss related to their own families. And, you know, holding on to those things and still coming in and serving every single day. I think took a lot of tenacity, and I have a lot of admiration for our staff and just really appreciate a lot of the sacrifice that people made at a time that was really uncertain. People had to suspend their own concerns and fears to be of service to other folks. That's not an easy thing to do. So, you know, I think we are still really trying to recover from some of the challenges that time, you know, sort of erected for our staff, and trying to you know, backfill for positions that are open, you know, some of the same kinds of challenges that I think most people are having. So, you know, those are some of the big things we're doing. We also managed to do a groundbreaking for a new housing project. So in the midst of all of these things, one of the things that we did was build new housing. And so we have a project over on 1202 East Preston Street that we are co-owners of with Episcopal Housing Corporation. It's a 70-unit affordable housing development that will serve 35 individuals at 50% AMI and 35 individuals who are exiting homelessness. We are right in the middle of all of the background checks and HABC qualification appointments and all of those things. And we anticipate being able to move in individuals any day now. So that is a big part of the work that was also happening in concert with trying to keep things, you know, moving and attending to people's needs during the pandemic and trying to be good stewards and good and be of good service to our staff here as well. So yeah, I think those are the sort of the biggest things that have been happening over the last couple of years. I will say, you know, when you ask the question about what we should do, what you may be thinking about with respect to more advocacy related things, I think, you know, overdose prevention sites are sort of top of our minds here. We are supporters of overdose prevention sites as an organization. We know that providing people with dignity and ability to be able to connect with services can be life-saving. We know that a lot of the interventions, and we also know that the pandemic brought with it a lot of individuals who died from fentanyl. You know, fentanyl, I suspect, is in every single thing. We have individuals that come through our doors that don't even have opioids in their system and have fentanyl in their system, along with other things like benzos and marijuana. So we know that fentanyl is here to stay, and we know that it is lethal, and we know that it affects the individuals that we are serving in particular. And so that's something that I think we are very much supportive of, and always willing to have conversations about how we could be helpful in that space if the opportunity presents itself.
If you could wrap up, we want to make sure.
Oh, of course. Yes, of course. So yeah, so lots of things that be happy to spend more time and talk about the work that we are doing. But I will stop there and see if there's any questions.
Delegate Bartlett, is this part of the big list of questions that you had for healthcare for the homeless, or Delegate Lehman? Not sure if you have any questions for Ms. Williams. No, okay. I guess just a brief one. As you said, healthcare for the homeless it's a well-established, well-funded agencies. I think I'd like to have a sense, and if you don't know, we will try to find this out. But of the other providers who are in this space of supporting and helping individuals and periods of homelessness or mitigate the negative impacts, et cetera. Do you have a sense of how many or how they've been able to fare through the last couple of years? And just briefly, if you know.
Yeah, I do. I think it's been a little bit of a mixed bag. I think larger organizations, obviously have been able to weather the storm. The more staff you have, the more you can withstand when you have shortages. So I think it's been, you will see it align very closely with organizations that are typically a little bit more well-established and larger, tended to fare better than some of your smaller, more grassroots organizations. We saw this with Yes as an example that closed their doors during the pandemic. And so it was quite unfortunate because they were such a staple in the community, particularly working with youth. So
I think, again, colleagues, I know we'll wrap up soon, but I certainly think, I know in our other joint committee of children, youth, and families, and looking at our childcare providers and the thousands that we lost over COVID with the greater need and the importance, we also need to look at, I don't know if this is Stuart or how, what is the census of providers and how many, who made it and whose doors were closed, and what can we do to maybe come up with some formulas and platforms as we did with the childcare. I mean, we still have a lot to do for that sector, but I think that is a very good model that perhaps we could look at see if there's federal money, how we can come up with a plan and make that as a recommendation that we come up with that. Colleagues that are left, do you all think that that's probably something we should do? I think they're nodding, yes. Okay then, and Stuart nodded as well. All right, well, I don't have any other closing comments other than to reinforce what I said at the top of the hour, and that others have said. Delegate Lehman said, housing, affordable housing must be what we drive towards. Delegate Bartlett suggests that are we simply with just a rapid rehousing and temporary and transitional housing, is there just a permanent population of people that are just cycling through and not really, what are we doing? Are our interventions sustainable, one, and also are they truly transitioning individuals into stable housing so that we can get to move forward with others. So building more affordable housing and being more creative. Something that this committee voted to do and we were not able to do is looking at how can we transition vacant commercial properties, into housing. We wanted to look at that. We wanted to study that. What role does accessory units transformations play in creating affordable housing? And then again, we've done a good job at the social determinants. I think we can do more, but as an agency, DHCD and others, we have to start building some things, and jobs and opportunities is absolutely really key. So I want to thank all of you. I want to thank the staff who have supported this committee. And I was going to close that Delegate Valentino Smith and I started in this together. We've, over the 12 years that we've both served, have fought this fight together in bring attention to youth homelessness. And then as we learn more about all of the support agencies and understanding the interconnectedness and her drive to really just really make sure that our benefits to poor and working families are all they could be, and knowing that they're not, and just her relentless pursuit on that. So I, Delegate, I'm just very, very grateful for your partnership, and I look forward to continuing to work with you as we go forward, because I know you're not going to let these go. And thank you so much, Delegate Lehman, for reminding all of us to make that. So everyone, have a great day, have a good week, and happy holidays. I guess I will, put the gavel down if I had this meeting of the Joint Committee of Ending Homelessness is